Hey everybody, ReMar nurses, what's going on? Welcome to another Winning Wednesday. And so as you can tell, today is a very special episode. Professor Regina asked me to do something very interesting tonight. She asked me to do something very interesting. She actually asked me to cover her shift. I couldn't believe it. Professor Regina asked me to cover her shift because she said she had to go back to bedside nursing. That is right. She had to go back to bedside nursing, and I am here covering her shift. She has a very, very important patient that she is taking care of. Actually, two very important patients. Number one, she's actually taking care of herself on tonight. She's taking care of herself. I'm saying it says no sound. Let's see, make sure we got some sound. Okay. She's taking care of herself on tonight. And second, number two, she is taking care of Shiloh. All right. She's taking care of Shiloh. She's taking care of herself. And so she has two very important patients that she's covering for tonight. So she asked me to float her shift tonight. And I said, you know what? I can do that for you. I can do that for you. So I'm here. And so what we're going to do is I'm just going to cover some of the basics with you. Also, we're going to go into see some of the lecture content from the NCLEX V2. And that's one of the amazing things of the V2 is that whenever your NCLEX instructor is not available, you have her all the time at your disposal. And so that's one of the benefits of the V2 is that you have Professor Regina at your disposal any single time, every time you're ready to study inside of the V2. And so we're going to do a lecture for you. We're going to cover, let's see, we're going to cover the lecture content of, I think we're going to go with, I believe, the subject of antibiotics is probably in order because I think that's what they might need at this time is antibiotics. So we're going to go into the V2. We're going to study the topic of antibiotics for NCLEX. And as soon as you are ready to go on that note, we will have that lecture. And so what I am so excited for is that everybody that has got the V2 over the last month, over the last 30 days, you've done a 30-day challenge, you're in there, you're studying, or maybe this is your first time learning about ReMar. So if it is your first time, welcome to a Winning Wednesday. My name is Mark. I am your NCLEX chaplain, if you will. ReMar, we are a faith-based company, and so we believe in covering our students with prayer and also sharing the word of God with you as well on your journey. Regina is the #1 NCLEX instructor on the planet, but on tonight she is taking care of herself and also taking care of our daughter, Shiloh. So she's also the #1 wife and mother on the planet to me. And so congratulations to everybody that I see here passing NCLEX. Good evening, good evening, good evening to each and every one of you guys. And so if you are ready to go, just say, I'm ready, and we will get into our lecture. Also, if you have passed NCLEX using the NCLEX V2, I'm going to put a link here in the comment section, and I'm just going to invite you on to share your story. We'll just verify that you have a V2 account, and I'm going to invite you on to share your story as well. So if that's you, go to hit the link, put your full name into the name bar. We'll verify your account and then bring you onto the broadcast. You can wish Professor Regina good health, just like you wished her happy birthday. And then also we want to hear your story about passing NCLEX and being successful. So I'm going to drop that link right now. That way you can see that. And after we do the lecture, we'll come back and see if anybody wants to go live and just share your story for the ReMar nurses. So if you are here, right now, we're going to get into the content from the NCLEX V2. The NCLEX V2 is the training package that has all of the content, all of the questions that you need to pass NCLEX in 30 days or less. We also have different options for 90 days or 6 months, depending on if you're still in nursing school, if you're an international nurse, or if you have not yet scheduled your exam. Also, want to let you know that we do have a sale going on at remarnurse.com right now. We have the Quick Facts for NCLEX book is half off, guys. Quick Facts for NCLEX is half off right now. And this is one of those resources, like if you're studying for NCLEX, if you're taking NCLEX soon and you don't know when to start, right? You don't know where to start. Quick Facts is the key, right? Quick Facts has the content that you need to make everything very simple. And it's the starting place for your V2 lecture series, okay? So if you're using another review and you're like, man, I really need the content, start with Quick Facts. Not only that we have the Quick Facts for NCLEX, but if you're still in nursing school, we also have Quick Facts for Nursing School. Quick Facts for Nursing School is an amazing expanded version of the Quick Facts book, guys. And so this is a book that you want to use as a reference guide in nursing school. And then after nursing school, you transition into Quick Facts for NCLEX because it's just the content that you need to know to be successful with your NCLEX exam paired with the virtual trainer, the V2. All right, so guys, we're going to go into the NCLEX V2 right now, and we're going to look at the topic of antibiotics. And so even though Professor Regina is taking care of herself and Shiloh, she is available for private tutoring right now. She's available. Sometimes you guys ask, like, do you offer private tutoring? And she doesn't offer private tutoring in that sense because she would hate to say, you know what, I'm sorry, I can't help you because there's one other ReMar nurse that needs assistance. But with the NCLEX V2, everybody on here right now can study with Professor Regina as if they're studying one-on-one from the comfort of your home, from your phone, from your laptop, whatever that might be, whatever you're watching me on right now. So we're going to get right into the NCLEX V2 and look at the topic of antibiotics. All right, here we go, guys.
Blood. So again, these antibiotics. We are going to get into some pharmacology now. The more we study together, the more I will introduce pharmacology to you all. We are starting with antibiotics, and I want to look at 3 major classes of antibiotics that will be helpful for you throughout this review. So we're going to talk about aminoglycosides. We're going to look at some examples, how they help and how they harm. And this is kind of the scope of thinking that I want you to have when you are reviewing pharmacology. So, aminoglycosides. Can you think of some examples of aminoglycosides? If you can, go ahead and write them down. If you need help, let me tell you some examples. Clindamycin, gentamicin, streptomycin, azithromycin. So now that I probably said them, you were like, oh, those are aminoglycosides? Yes, aminoglycosides end in the mycin. There is one, vancomycin, that is always put in the aminoglycoside group. However, it's not an aminoglycoside. Vancomycin is not an aminoglycoside. It's a macrolide, but it's usually grouped with aminoglycosides because it has similar side effects. So make a note of that. Now, how they help your patient. Aminoglycosides are very powerful antibiotics. So they treat big infections such as meningitis, infective endocarditis, or infections of the heart, and also septicemia. What's septicemia? Septicemia is an infection in your blood. So again, these antibiotics are for serious kinds of infections. Now, this is the NCLEX point that you want to know. Aminoglycosides can be ototoxic. What does ototoxicity mean? It means it causes damage to your ears. Yes. So clients who take aminoglycosides may have hearing loss. They may have tinnitus, right? Aminoglycosides, not only are they ototoxic, but they are also nephrotoxic. And nephrotoxic leads you to the what organs? The kidneys. Yes, aminoglycosides. There's actually two. They are called the peak and trough. Have you ever heard of these before? The peak and trough. The peak and trough, they are important because they're used to determine the concentration of a drug in the body. So this will help to see if a medication is reaching a toxic range. So for the peak and for the trough, I'm just going to tell you when to gather them. So the peak, you get the peak of a medication an hour after it has been given. Now, this is if it has been given PO. This is if it's been given PO. Then you draw the peak 1 hour after. Now, if the medication was given IV, then you get the peak 30 minutes after you give it. Now, for the trough, the peak tells you the highest amount of drug in the body. The trough, you're looking for the what? The lowest. So normally you get the trough immediately before the medication is due, because at that point, then the medication is leaving the patient's body. So normally people say about 5 to 10 minutes before the next dose is due. So you want to have everything ready so that you get your trough right before that medication is due. Does that make sense? All right. Here is a question for you about aminoglycosides. What is the antidote if a patient has too much clindamycin or gentamicin in their body? We need to give them a medication. The antidote is going to be calcium gluconate. Calcium gluconate. All right. Now, can you give this during pregnancy? Can you give aminoglycosides during pregnancy? Yes or no? What do you say? The correct answer is no. You cannot give aminoglycosides during pregnancy. All right. It will cause harm to that baby. All right. Let's move on to the next medication. Okay. So the next antibiotic we're going to talk about is penicillin. Most people are familiar with examples of penicillin. I'm just going to tell you a few. They are ampicillin, penicillin, or amoxicillin. How penicillins help your patient? Oh, penicillins are very good for urinary tract infections, STDs, or sexually transmitted diseases. And also, penicillin is great to fight off pneumonia. How they harm your patient. What is the number one thing you want to know about a patient before you give them a penicillin? What do you think? It is to check for allergies. You have to ask that patient, are you allergic to penicillin? Because if they are, we don't want to give them penicillin. Let me ask you this. What are the signs of an allergic reaction? If a patient is given penicillin and they start to become allergic, what are you going to see? You're going to see hives, itching, rash, right? They're going to have some swelling, difficulty breathing. These are the signs of their allergic reaction. So if a patient is having these signs in front of you, you've given them penicillin, they're starting to have anaphylactic shock, what are you going to give them? What is the antidote for a penicillin allergic reaction? It is epinephrine. I want you all to know epinephrine is the medication of choice for your NCLEX exam. All right. Now, before I go, I got to ask this about penicillin. Is it safe to give during pregnancy? What say it, you guys? The correct answer is yes. This is our pregnancy safe, breastfeeding safe antibiotic. It's always going to be penicillin, penicillin as your first choice if the patient doesn't have any allergies. Now, I want to move on to the next medication class, which are the tetracyclines. Patients can get tetracyclines if they are allergic to penicillin, because they kind of treat the same things. But let's start by the examples of a tetracycline. They are doxycycline, minocycline. So medications that have the cycline at the stem are going to fall into this class. Like I said, tetracyclines treat the same things as your penicillins. So we're going to put down how they help your patient: urinary tract infections, STDs, pneumonia, and I also want you to add acne. Tetracyclines are given to help fight off teenage acne. How they harm your patients. This is important. Tetracyclines are nephrotoxic, which you guys know. They are also phototoxic. What does phototoxic mean? When a client is taking a medication that causes phototoxicity, it is going to cause damage when the patient is in the sun. So direct sunlight will cause damage. They'll be sensitive to, and this is by way of the skin, of course, they're going to have a severe sun sensitivity because of that phototoxicity. And then tetracyclines are also hepatotoxic. What does it mean if a medication is hepatotoxic? Where does it cause damage to? That's right, it's going to cause damage to your liver. Liver. All right, the children precaution for tetracyclines is that for children under the age of 12, tetracyclines can stain the teeth. They can cause the teeth to present as a silver or a black color. The food interactions that will cause tetracyclines to become ineffective, here they are milk, iron, calcium supplements, and antacids. You don't want to take tetracyclines with any of these kinds of foods or medications. Final question here before we do a practice question. Can you give tetracyclines to a woman who is pregnant or breastfeeding? What saith you guys? The correct answer is no, you don't want to do that. Okay, so that is a rundown of aminoglycosides, penicillins, tetracyclines, and your major NCLEX points. Now, let's apply what we just studied to some practice questions. You can take a minute to do them by yourself, or I'm going to get started right now with them. Number 1 says, a client is scheduled to receive clindamycin at 9 a.m. At which time should the trough level be drawn? Okay. What do you guys think? Here are the choices. 1, 7:30. 2, 8 a.m. 3, 8:45. Or 4, 9 a.m. Which time should that trough level be drawn? The correct answer is number 3. It is going to be 8:45 a.m. because this is the closest time to when that medication is due. So you want to catch it at the time. And remember, it may take a while for you to draw your client's blood. So you want to get started and give yourself, depending on your skill level, you know how long it will take you to draw the blood. You want to catch it right before that medication is due. And remember, when we're doing NCLEX questions, we want to look at the 4 choices that we're given and pick the best one from which we are given. Let's go on to the next one. 2, a teenage client has been prescribed a tetracycline for moderate acne. Which of the following statements is the highest priority in the client education about the medication? Number 1, use sunscreen when you are exposed to direct sunlight. 2, monitor the teeth for color changes. 3, report any signs of hearing loss to the healthcare provider. Or 4, reduce the amount of fat in your diet to decrease the presence of ketones. Now, I love this question because this is a perfect example of how strategies will not work for NCLEX. You have to know about the subject. You have to know about the content in order to get the answer correct. And the correct answer is number 1, use sunscreen when you are exposed to direct sunlight. You guys are able to answer this question because you know tetracyclines cause photosensitivity. This is how we get NCLEX passed. We study the core content so that we're able to use our knowledge. We're able to use our knowledge to answer the questions appropriately. There's no tips and there's no tricks for nursing education. You have to know it. The third question says, a nurse is caring for an elderly client who has pneumonia. The healthcare provider prescribes penicillin PO for 14 days. When the nurse asks the client if she has a penicillin allergy, the client states she does not know as she has never taken the medication. Which of the following is the best response by the nurse? Okay, here are our choices. Number 1, I will administer this medication and stay with you for monitoring after you take it. 2, I will hold the medication and clarify the order with the healthcare provider. 3, I will notify the healthcare provider and suggest a different antibiotic. 4, I will notify the pharmacist and discuss other alternatives. So the correct answer here, and let me just break out the scenario again. You have an elderly client. They're diagnosed with pneumonia. The doctor prescribes penicillin. So the nurse says, have you ever had a penicillin allergy? And the patient says, I don't know. I've never taken penicillin before. So in this situation, what is the best response by the nurse? It is number 1. I will administer this medication and stay with you for monitoring after you take it. All right. This is what you do. It's no different if a client has been prescribed blood, right? If a patient says, I've never had blood before, the nurse is not going to say, well, let me go call the doctor and clarify this order. There's nothing to clarify. Blood was ordered. There's nothing to clarify here. Penicillin was ordered. The patient has never had it before. So what is the best response by the nurse? It is to give the medication, carry out the order, and stay with the patient for monitoring. And remember, we stay with the patient, we monitor with them in the room present for 15 minutes. And then we continue to monitor them for a full 30 minutes, taking vital signs, making sure everything is okay. But we certainly do not need to call the healthcare provider to clarify the order. It's already clear. And we would not be appropriate to suggest a different antibiotic. That would be appropriate if there was a penicillin allergy. But as of yet, we don't know. And also the pharmacist, he doesn't have anything to do with it at this time, right? So I want you guys to think about your scope of practice and what you can do as the nurse when you're facilitating medication administration. All right. So challenging questions, I know, but they're used to help you identify weak areas. so that during this process, you know what to study. All right, that's antibiotic overview. Let's move on.
Okay, everybody. Okay. I hope you enjoyed that lecture. I hope you enjoyed the lecture on antibiotics. Hope you enjoyed the lecture on antibiotics. And so now listen, with ReMar, we have a philosophy, okay? We have a way of doing things, a way of studying that gives the ReMar nurses the highest advantage when it comes to taking this test and passing this test. So the first thing that we always do at ReMar, right? The first thing that we want every single ReMar nurse to do is to focus on the content. All right. That's the one thing, well, that's one of the many things that ReMar does better than any other NCLEX review, resource, or study system, is that Professor Regina breaks down the content like no other. And so after you do the content, then you can answer questions. So many resources, so many reviews come up and say, hey, do 75 questions a day, do 100 questions a day. And I know some of you guys have tried that approach and it's just led to burnout, right? But with ReMar, we focus, guys. I see it right here. We focus on the content. All right. So the content comes first, and then you can start to answer questions. And so what I want to show you is that inside of the NCLEX V2, we have content, which you just saw. You just saw the lecture content from inside of the NCLEX V2. We have these courses that you go through step by step, right? Starting from pregnancy, maternity, and child care. And then you go into your other disciplines. You have basic care and comfort. You have ortho, medication administration. We just watched the antibiotics, guys, pain management, all right, substance abuse, body positions, disaster management, triage, things of that nature, ABGs, diabetes, overview, endocrine systems, and it goes on to your EKG, etc. We focus heavily on the content in short video lectures. So as you saw, you just watched the antibiotics lecture. I believe it was about 15 to 18 minutes, and you got the content that you need to know in order to answer the questions. So now we just focus on the content, and then after you have studied your content, then you are ready for your questions. You are ready for your questions. All right. You see, you'll hear over 2,500 questions. Over 2,500 questions. You can create your quizzes, right? Similar in fashion to UWorld in that sense. You can select your difficulty, all, easy, medium, or hard. You name your test, put that test. You can put it in tutor mode or test mode. You can also create a CAT exam as well. As you are building your content knowledge, you're using the questions to help build your content knowledge. So guys, passing NCLEX is about focusing on the content, right? Studying with the ReMar NCLEX V2, you have the #1 NCLEX instructor who breaks down the content, even when she's bedside, treating somebody bedside, which is her daughter and herself, even when she's sick, she's still the best because you can study with her anytime from the comfort of your home, from your phone or a laptop. So after you study the content, then you're going to focus on the questions, guys. So we have the question bank. We have the CAT exams. I saw somebody asked a question. Somebody asked a question. The question is, here we go. When you have the V2, how many times are you to take the CAT exams? Please, I need help. All right. So when you have the NCLEX V2, you have 2 built-in CAT exams, with every subscription for your V2. Now, if you, and we recommend that you take your first CAT exam after you've completed lesson number 20. After you've completed lesson number 20, that means you've studied all of the content in the review side. You've done the course exams as well. And now you're ready for your NCLEX simulation after you've completed lesson number 20. That's when you do your first CAT exam inside the V2. Now, once you do your get your results for the CAT exam, it's going to be a pass or fail, just like NCLEX. Just like NCLEX, it could shut off early, or it could give you the full scale of questions depending on how you are responding and how the system or the algorithm is determining whether you are at that passing standard or below the passing standard, right? So that's your first CAT exam. Once you have your assessment, then you're able to look at the categories where you were successful or unsuccessful, if you passed or failed, and then go back into your content section and focus on those areas, or create exams inside of your Q bank that you have with your V2, right? In order to focus on areas to strengthen that content knowledge. Now, so you have 2 CAT exams, but you can also purchase additional CAT exams for like a very, very reasonable cost, guys. So you have your content first, then you have your questions, and then you have your CAT exams, and then you have your refinement of going back over your notes, going back over your workbook material, going back over your quick facts, leading up until the time that you test. Now, so every time Professor Regina comes on, right, I'm covering her shift tonight, so I'm going to do exactly like she does. First, you study the content, and then you do what? First, you study the content, and then you do what? Help me out here. First, you study the content, and then you answer what? You answer questions. That's right. You answer questions. All right. Let me see basic facts. How do I get it? I see a question here. It says, I need the V2 and basic facts. All right. Hold on. How do I get it? Hey, listen, I love it. You need the V2 and quick facts, right? Quick facts for NCLEX. How do I get it? The answer is simple. You study with Professor Regina. You get the NCLEX V2. You get the quick facts for NCLEX at remarnurse.com. remarnurse.com. So look, remarnurse.com. remarnurse.com is where you go to get your NCLEX V2 and your quick facts package, okay? So that you can study with Regina at any time that you want. Anytime you get ready, she's ready inside of the NCLEX V2. All right, so first you study the content, then you answer questions. So now, guys, get ready. I have some questions for you, okay? We studied the content, but my questions are a little bit different, right? So I'm not a trained nurse. I am the president of remarnurse.com. I am the chaplain of ReMar Nurses. I am the husband of the #1 NCLEX instructor, but I am not a trained professional in nursing. I just have a heart for you guys, and I believe in the mission of helping the ReMar nurses pass NCLEX so that you can be a blessing to your family, so that you can take your career to the next level, so that you can get unstuck and unlock the vision and dream that God has given for you. That's what I'm here for. So my questions are a little bit different, okay? But I do have questions for you. And I need you to put that into the comment when I'm asking the questions, all right? So question number one. Question number one. This is just a yes or no question. Yes or no question, all right? Question number one. Renee, I see you. Question number one. Christina, I see you. You're ready. Marie, you're ready. Question number one. Question number one is this. Do you need to pass NCLEX? Yes or no? Do you need to pass NCLEX? Yes or no? All right. Put your response in the chat for me. Do you need to pass NCLEX? Don says, yep. Eunice, yep. Danita, Kim, Joyce, Van, Sandra says, yes, I need to. Emma says, yes. All right. VJ, yes. Denise, Annie, yes. Jillian, yes. Okay. Yep. I need to pass NCLEX. Kelly, I see you. Jacqueline, I see you. You need to pass NCLEX. Anita, she says, Megan says, of course. Like, of course I need to pass NCLEX. That's why I'm here. Right. Dude, Florence says, yes, I do. Victoria says, that's why I'm watching. I'm watching to see. Right. All right. Do you need to pass extremely? Naisha says extremely badly, right? Extremely badly. That's the first question. The first question is, do you need to pass NCLEX? All right. Naomi says yes. Tish says yes. All right. We studied the content. Now I'm asking my questions. Okay. That's question number one. It looks like it's unanimous. Everybody here says, I need to pass NCLEX. All right. I need to pass NCLEX. All right. Sharon says yes. All right. Here is extremely badly. Of course. Yes, with the S's. Like, yes, I don't want to do it like that. But yes, I must, I can, I will, I must pass NCLEX. So number one is yes. If you are here tonight, you need to pass NCLEX. That is the first question. Now, let's clear the slate. Question number two. Question number two. All right. Did you understand the lecture that you watched tonight? Were you able to follow the lecture that you watched tonight from Professor Regina on antibiotics? Put a yes or a no. All right, just a yes or a no, or I'll put another option is I'll put kinda, right? So yes, no, kinda, or somewhat. All right, yes, no, or kinda. All right, let's look. All right, Maria says yes. Kelly says yes. Michelle says yes. Aspect says yes. Trisha says yes. Cherry says 100%. Dawn says yes. Annie says yes. Siobhan says, yep, I got it. Jan says, yep, I got it. All right. Marie says yes. Patience says yes. Okay. I understood. Yep. Yep. Ruth says yes. Evelyn. Denise says, I understood the content. I understood the lecture from tonight. Okay. Yes. V2 here. Somebody has. Okay. Talithia says yes. Okay. All right. Danny, who else? Who else? Who else? This is the question. This is a real question, guys. This is a real question. Just like you're answering the questions from Professor Regina, I need you to answer my questions too, right? And by the way, I do need you to like this video because this needs to be the #1 most liked winning Wednesday. Because like if it's not, she ain't gonna have me back. She's gonna say, listen, she's not gonna trust me to to be with you guys. So I need you to run the numbers up. Okay, Mandy says yes, I understood. Sandra says yes, I understood. Marie says yes. Eunice, yes, I understood. All right, cool. I think that we got it. It's unanimous. The majority of you guys, in fact, not everybody, says yes, yes, yes. I understood the lecture that I watched tonight. Okay, next question. Clear the slate. Clear the slate. Question number 3. Question number 3. All right, here it is. So being that the majority of you said yes, you need help with NCLEX. You said yes, I understood the content that I've seen tonight, right? So the next question is simply this. Do you believe that you can pass NCLEX with the V2? Do you believe that you can pass NCLEX studying with Professor Regina inside of the V2? That's the question. Yes, no, or maybe. All right. Yes, no, or maybe. Those 3. Do you believe that you can pass NCLEX studying the content from Professor Regina inside of the NCLEX V2? That's the question, right? The V2 is the online training platform created by Professor Regina that breaks down the content, that gives you the questions, and presents you with CAT exams to test your knowledge as you prepare for NCLEX. Do you believe that you can pass NCLEX studying with Professor Regina inside of the NCLEX V2? All right, I'm seeing definitely. I see Tisha says yes with the 4 S's. Fatu says yes. Katrina says yes. Edma says yes. Leah says yes. Rita says yes. Right? Okay. I see it. Yes, I do believe that I can. Yes, I can. I can. I will. I must. I can. I will. I must. Right? And so, okay, here we go. Willetta says yes, I believe. Okay, I will pass. Okay, let's go. Let's go. Let's go. That's what I'm talking about. All right. Aline says yes, I will pass. Marcia says yes. Okay. Now Emma says yes. Says yes, I will pass. Aspect, I will. I will. Amen. Of course I will. I believe I can pass, but I need God's guidance, and my anxiety is very high. Paula kept it all the way real. Says I can do it. She says I believe, but help my unbelief. All right. Listen, I'm so excited for you guys because listen, if you can answer those 3 questions, there's only one more question that you have to answer in order to be successful, right? By God's grace, I see that. I believe that. I receive that for sure. By God's grace, yes, I can, right? Yes, yes, yes. All right. Okay. So if you believe that you need help with NCLEX, right? If you believe that you understood the lecture material, the content that you saw tonight from Professor Regina, even though she's sick, right? You still got her best. Like she delivered her best, even though she's sick, even though she's watching over her child, like you guys have to do as caretakers, as mothers, as husbands, as wives, as spouses, right? As daughters, as sons, whatever, your role is. Sometimes life is just lifing and you have to fill in the blanks and still be at your best, right? And so even though, so if you understood the lectures from tonight, you need help with NCLEX, you believe you can pass NCLEX with the NCLEX V2. So the next question is kind of like an open-ended question. It's like, what's stopping you, right? What's stopping you guys? Like, what's stopping you from getting the resource that you need to make it happen and pass NCLEX? What's stopping you, right? Is it like, are you torn between 2 decisions? Like, should I study over here or should I study over there? Is it like, I'm still like allowing anxiety to take over when God gave me this dream? Like, what is stopping you guys? Right? Fear, anxiety, I see that. Finances, I see that. Funds, I see that. Okay. Now, anxiety, and I'm gonna ask you one more question. Vondi, I see your question. How much is the V2? Right? How much is the V2? I'll tell you this. If anybody has ever done private tutoring, if anybody has ever looked into private tutoring, I'll tell you the V2 right now for 30 days is about the cost of 1 hour of private tutoring. Okay, I'm gonna say it again. The V2, the NCLEX V2 with Professor Regina for 30 days with your question banks, your CAT exams, with your lectures, right, is about the cost of 1 hour of private tutoring. We've made this thing by God's grace so affordable that yes, you will have to sacrifice something, right? But we wanted to put it in a place that it can be a blessing to you. It can be a blessing to your family. Like I've seen testimonials of nursing students getting their license after being out of school for 3 years, 2 years, 5 years, and spending less than $100 to pass NCLEX. Like what? After they've spent literally $500, $1,000, $2,000 with other resources over time, and then they get the V2 for under $100, and then they pass NCLEX. Like, I'm so excited every single time I see a testimonial like that. Now, I see all of the issues in terms of like, what might be holding you back, but I can tell you right now, I'm not even going to ask you the question. I'm just going to give you the answer, is that none of those things are none of those reasons, none of those justifications the thing that's holding you back is bigger than your God, right? None of those situations that's keeping you from the vision that God has given you, or the thing that He's placed in your heart is big. None of those things are more than God can deal with in your life, right? I read somewhere that God would supply all of your needs, and I really believe that. And so that's why we're here tonight. Regina needed me, right? Just to step in and to help be a blessing to you guys. And you guys are really blessing me. Thank you so much, number one, for all of the encouragement that you're giving me. And Mark, you're doing a good job. All right, you're doing a good job, and I really appreciate that. Okay, I just want to let you know I really, really do appreciate that as well. And so what I want to do real quick is just share with you one of the testimonials from a ReMar nurse that was, let's say, struggling with NCLEX, that needed help to reach her goals, but she stepped out on faith. She gave ReMar a try, and she resonated with the content. She connected with Professor Regina. She embraced the community. She went to remarnurse.com, invested in herself, and now she has a nursing license. And I just want to take a moment to share this with you as well. And then I'm going to show you how you guys can get the NCLEX V2 or at least get the free trial so you can see what it's all about. Here we go. Let's check out her story right here. Nurse Daniela.
My name is Danielle, and I just graduated nursing school in December. Then I used ReMar to study for my NCLEX, and I absolutely positively love this program. I'm already an LPN. When I did my LPN, I used UWorld, and I like UWorld. There's nothing wrong with UWorld, but I really love the fact that ReMar has so many videos, more of like a refresher course from anywhere from the basic things to the more complex things, stuff that you thought you knew, or maybe you thought that I forgot. I was able to brush up on all type of skills that I needed to remember. I love that after ever so many videos, you have like the exam in there to help you kind of tie everything in, had you thinking, had you on your toes. I really, really did enjoy that. Instead of just answering question after question after question, you was able to kind of be in study mode without necessarily all the extra schoolwork tasks that you had to do on top of it. I really, really did enjoy this program. I like that you had to go in order. It kind of helped you stay on top of everything. I love the homework that was given with it. There's so many things I can really go on and on and on and say. But it was very, very, very helpful. And it also didn't make me feel like I was getting burnt out of just sitting down and just reading, or just sitting down and just going over so many questions. Like so many of my friends, like, yeah, I did 100 and something questions today. I'm gonna keep trying to do, and then they're so tired and burnt out and get discouraged because the more they do, sometimes they start doing not necessarily bad, but answering questions wrong and kind of feeling defeated. So I told them this program is absolutely wonderful. Like I said, I really like the videos. I like the content. It was easy to follow along. I like the visuals, the exams. I like the fact that you had to kind of redo them until you got them right, or at least scored a certain percent to kind of, it made me feel like I was able to grasp the concept and actually kind of go back and or either jot down stuff that I know I needed to study. But now that I have officially graduated, I'm definitely so happy to like not have to study anymore. Have a little more free time to spend with friends and family. But as far as for nursing wise, I'm so excited to be able to start my new journey. I got offered a job at Mother Baby, which is kind of where I wanted to start at my nursing career as now that I'm an RN. Absolutely, positively, just love it. But I would definitely recommend getting this. It's definitely a 10 out of 10. And I would like to say I passed NCLEX Next Gen with ReMar. Bye.
Amazing. Amazing. Listen, guys, this doesn't happen in isolation. Okay. You might be looking at her testimonial and think, well, man, if I could do that. I'm telling you, there are so many other ReMar nurses just like her, just like you, that are reaching for their goals, and God has put them, and God has put you in a place to be able to receive the help that you need. So a part of what we've done actually with the NCLEX V2 is we're so proud of the ReMar nurse family. We have to brag on you guys just a little bit. We told you about the content lectures, right? You might not know, but there's also an NCLEX 30-day challenge that helps you to study every single day for 30 days so that you can stay on track. We do have a 30-day subscription to the NCLEX V2, and so this helps guide you through those 30 days. You can actually access that free. I'll tell you about that in a second. But we also have, what we have is the ReMar Nurse Success Stories, the ReMar Nurse Success Stories. So many of you guys are passing NCLEX. So many of you guys are believing in yourself, are trusting God and going in faith, that we had to be able to also tell your story, okay? So these are nurses that passed in 85, like the minimum number of questions. They passed in like 85, and it just keeps going. It just keeps going. It just keeps going, right? You can watch their stories inside of the NCLEX V2 under the success story section. We have nurses that passed on their first attempt. You say, well, I'm not a repeat test taker. I'm in nursing school right now. I don't know what to get. So these nurses passed on their first attempt, and it just keeps going down the line, keeps going down the line. We have a lot of nurses that were repeat test takers, guys. They tried everything to pass NCLEX, but they were unsuccessful using multiple resources, or they've been out of school for a long time. Repeat test takers. So we put the stories in here, and that just keeps going. It just keeps going, guys. You say, well, hey, how does it compare to UWorld? UWorld is a great review, but it's not for everybody. Maybe you've tried it, maybe you haven't. But if you've tried it and it hasn't worked for you, I'm telling you guys, give ReMar Review a try. We focus on the content and then answer the questions, and that's how you are successful. So give ReMar a try. You may have tried Archer. That's good as well. You may have tried Chaplain. That's good as well. But if it didn't work for you guys, then you need something else that's going to be beneficial for you. If you're an international nurse, right? If you studied outside of the United States and you're looking to get your license, ReMar is really the way to go, because we break down the content like no other. So I showed you the testimonial section, the ReMar Nurse Success Stories inside of the NCLEX V2. Also, I showed you the 30-day challenge inside of the NCLEX V2. And I want to let you know that you can actually access those sections for free if you go to remarnurse.com and just do the free trial. You can go to remarnurse.com and sign up for the free trial. If you were somebody that said, you know what, I believe I need help passing NCLEX. I believe that I can learn, that I understood the lecture from Professor Regina tonight. I believe that I can pass with the NCLEX V2, but money is the issue. I'm telling you guys right now, get inside the free trial. You can go to remarnurse.com, and at the very top, it says join free trial. You can join the free trial. You can study more lectures. right? You can probably study, I think, like the first week of content out of like a 4-week program inside of the NCLEX V2. You can also do the questions from the 30-day challenge. You can have access to the question bank, and it'll show you that there's a better way to study. Now, can you pass NCLEX just doing the free trial? No, that's not what it's designed for. The goal of the free trial is to help build your confidence, to let you know that you can do this. It's to help break that anxiety, right? To boost your confidence, break anxiety, and so that you can move forward and say, by this act of faith and joining the free trial, I'm going to see what it's about. And if I can understand it, I'm going to go with it. So I want you guys to get into the free trial. If you said, I want to do it, I need it, but I can't afford it, get the free trial. You have to do that for yourself. The other thing that I want you to do, if you said, I want it, I need it, but I just can't afford it, the other thing that I really need you guys to do is to take a step of faith and get the Quick Facts for NCLEX book, right? It's on sale right now for 50% off. If you go to remarnurse.com and you don't have this book, what are you doing, right? It's an amazing resource that Regina has given that breaks down so many NCLEX topics in just a short period of time. So many NCLEX topics in just a short period of time. There you go. I mean, it's kind of like having flashcards or a friend with flashcards, and it's going to really help build your confidence. And so if you guys take those steps of faith, get the free trial, get the Quick Facts, then you're really like halfway there to having the full content of the NCLEX V2. And if you're in nursing school, remember, we do have the companion resource, which is the Quick Facts for NCLEX for nursing school. This is a book that you'll use as a resource guide. As you're studying your topic chapters and subjects, you're going to look through Quick Facts for nursing school, find the topic that relates, and go ahead and study that content to build your knowledge. Somebody says, how much does it cost? How much does it cost? I'll tell you right now, you can do the 30-day, the Quick Start program for the NCLEX V2, which gives you your content, gives you your questions, and it gives you your CAT exams for under $100 right now, guys. So you can just go to remarnurse.com. It's actually a little bit cheaper than that, but you can go to remarnurse.com and get all of that for under $100. And so many students are really passing in like 3 weeks. So many students are passing. We don't recommend setting that as a goal, but if you're testing soon and you need to get it done, the ReMar NCLEX V2 is going to do that for you guys. And you also have a 90-day option, and you also have a 6-month option if you're still in school and you need a little bit more time to study. You get it now, you'll be perfectly set for a May, June graduation and transitioning into your NCLEX exam, and it covers you for your exit exams as well. So listen, guys, I believe that my job here is done tonight. You have been well served. The ReMar nurses have been represented. Remember, go to remarnurse.com. You can at least get the free trial tonight. You can get the Quick Facts for NCLEX or the Quick Facts for nursing school tonight. Take that small act of faith, and I believe that the next step is going to be revealed to you as you go. Remember, guys, we believe in you because God believes in you as well. You can, you will, you must pass NCLEX. Thank you for praying for Shiloh. Thank you for praying for Professor Regina. And thank you for running up the likes. Thank you for running up the likes. If you're watching this after the broadcast, hit that like button, hit that subscribe button. That's one of the best things that you can do for ReMar, is telling somebody else about this amazing resource, this amazing community, this amazing ReMar nurse family. As you are going on your journey, tell somebody else, take somebody else with you. Do not get to your point of success alone. Take somebody else with you, and God is going to bless you all the way. We really believe that. Now, remember, guys, you can, you will, and you must pass NCLEX. Until next time, keep us in your prayers. We'll see you soon. All right. Good night and God bless. Love you all. Take care.